All right, guys. Hi. Wanted to just put the lecture up for today for the material that we're going to cover in class. So this is really going over chapter 2 in the Principles of Athletic Training book by Prentice, really talking more about healthcare organization and administration. So really, and let me get this maximized so that we can see it. Ultimately, right, we need to ask the question, what exactly is it that we need to do? So let's say, for example, you're a brand new athletic trainer and you've taken a job. Um, and you now have the responsibility of setting up your own athletic training program. Okay, you found a job and you're the first ever athletic trainer at a site. Maybe you're at a high school. Maybe you've taken a job, um, you know, in the industrial setting in a warehouse or what have you, right? And you're it. And now you have to go through the process figuring out what it is exactly that you need to do, excuse me, to set your program up. So ultimately, when we talk about, getting a program set up, right? Obviously the first thing you need to do is really establish a needs analysis. So you need to ask the question, why do you need a program? Why is the presence of an athletic trainer so vital, in a given location, right? What are the goals? Um, and you need to really develop too, just a list of stakeholders that know the environment to determine, who people should be that really should be the main points of contact for answering those questions. Um, and ultimately, what is it that this place that you've been employed at or hired at is seeking to accomplish by having an athletic trainer there? How will you provide quality health care? And not only that, how will you contribute to the mission of you know of the entity to which you have been hired, right? So also we need to develop a mission statement, right? And that's going to involve stating what the focus of the program is, but also who will be involved in the program, right? And obviously, one thing that is also extremely important when continuously reviewing your program is to do what's called a SWOT analysis. So having strength, weaknesses, opportunities, and threats that you can identify, right? So one of the first things that goes into this is a policies and procedures manual. This really is uh, the key publication that every program has to have at a minimum to be able to operate. So this involves clear and accurate statements that are written that identify basic rules and principles, right, to expedite decision making. Not only that, right, the procedures define the process by which you do something. So ultimately, when I practiced in the collegiate setting, we had a policies and procedures manual that actually went through exactly um, what it is that the rules were that govern the program. Okay, those were known as policies, right? So what were our insurance policies? What were our policies on, pre-partition examination? What were our policies on concussion? All those types of things, right? And within those policies, we had specific procedures that had to be followed. Um, so ultimately, right, it's very important actually to include all of those types of things. And it's up to you, not only you, but also talking to your stakeholders to determine exactly what specific areas may need to be addressed. Obviously, a good resource for determining what it is that needs to be in your policies and procedures manual is also utilizing the NATA website and position statements as key areas of practice where you need to have some policies and procedures in place. So one thing that's really important, and that's going to have impacts from a liability perspective, right, is determining who exactly will you treat and which patients will you see. So often the athletic trainer has the task of being the first point of contact that someone has with the healthcare system, right? So in that way, we're practicing primary care, right? But one of the attributes of primary care is determining access. And part of that is determining who are your patients going to be. Are you going to see just athletes? Are you going to see, athletes and the general student population? Who will it be? So for example, if you work for a professional organization, right, you may only be allowed to see not only maybe players, but also employees of the organization. So it's not uncommon actually in the professional setting to not only obviously be taking care of players, but also to occasionally be, providing services, medical care for, potentially general managers and or administrators within that organization, like the Vikings or whoever, right, might be providing care for people throughout the organization, not just the team itself. Um, Obviously, and determining, when we use the word coverage, there's also a word that's been, we typically now prefer the term actually medical care, right? So we need to essentially determine how's that going to be delivered, what facility will you use, uh, how will that medical care be delivered, where will you position yourself, and how do you make those decisions of where to be and who to provide care to when, right? And what treatment options and rehab options will you have available to your patients. So there are other guidelines that we have to also follow as well, that we have to be compliant with. We have to obviously follow all OSHA guidelines as a healthcare facility, and even as a corporate facility in some cases. All of us, even by federal law, are obligated to follow OSHA guidelines regarding waste disposal and regarding patient safety, right? So it's really important to keep obviously things have a plan obviously for sanitation, and that goes just not to our not just to our athletic training facilities, but also any of our playing surfaces, gyms, any of those places, and that all is part of kind of the hygiene and sanitation piece, because there can be issues. And we dealt with this in the past where there were skin infections that were popping up in our patient population due to the mats not being appropriately clean in the weight room. And so that became a problem. So, yeah, obviously, and then developing hygiene practices for athletes, helping them, report injuries, illnesses, right? Making sure that, that we're dealing with skin conditions, right? Overall, helping them promote a healthy lifestyle. One way that we accomplish that in the collegiate setting is the NCAA has put out a lot of guidelines, um, regarding different things, whether it's staff, whether it's covering wounds, whether it's concussion, whatever it is, right? The NCAA has also provided a lot of recommendations along with the NATA to kind of help us accomplish this purpose. So, another thing that's really important is, in the event of a catastrophic event, be it an emergency, be it inclement weather, and now many programs have started to implement plans in the event that there is an active shooter or any other type of situation on campus. Um, it is extremely important to have written and clear plans for communication in regards to how those situations will be handled, right? How will you communicate with emergency personnel, and how will staff communicate with each other? Um, the financial aspect of things is extremely important, right? So depending on where you're working, you may have a very, you may have different types of budgets, and those budgets typically vary based on the setting, right? And so what is really important is to, obviously after taking a look at your situation, being able to essentially prioritize what it is that that you will need, what you believe may consume the most of your budget. For example, working in the collegiate setting, when I worked in that practice setting, we knew that because of the amount of patients that we had to take care of, that we had to allocate the vast majority of our budget to two things: insurance and supplies and operations. So the insurance budget that we had was roughly $250,000 that we had to work with. But then also our supply budget was approximately $60,000 to $70,000. So that's essentially how we had to essentially prioritize our budget, and then everything was broken down, um, kind of commensurately: travel, other types of things, right? There are different types of equipment though, and I'm sorry that that's so far down on the slide. There are different types of equipment, and it's really important to define what is what, right? So there's capital equipment and non-capital equipment. So capital equipment is essentially equipment that you buy that will last you for years. So an example of that within an athletic training room is going to be like, an Easton machine, a modalities unit, right? Those are things that we might buy once every 5, 10, 15 years. Oftentimes in doing so, maybe it's a gator, maybe it's a golf cart, pardon me. So in doing so, often there are times where those types of things may fall outside of the traditional budget, and it's not uncommon to have to request additional funding for those types of things from administration, right? And so then there's obviously, purchase, kind of perishable and or consumable items. That's like your tape, your bandages, all those types of things that you will buy over and over again every single year, right? And those things are typically fairly predictable and with hopefully minimal variation in cost, right? So another thing that's really important, we've touched on this a bit, but risk management, right? Security, really making sure that your athletic training facility actually is in compliance and has appropriate signage in regards to exit signs, fire, and fire evacuation routes. It's extremely important. And when we, design emergency action plans at the university that I was at previously, we actually defined entrance and exit points for EMS and fire, right, to come into the building when it was needed. And I can share examples of that if you guys are ever interested, right? So, but we also, within those, emergency action plans and security plans, there were specific scripts that were used actually, and steps that were used to initiate communication, right? One thing that's often common as well, part of risk management is making sure that your equipment is safe. So if you ever look in like the hydrotherapy room in the athletic training clinic or in the ATR downstairs, what you'll find often is that if you go into the wet area, right, you're going to, and even in the treatment area, you'll find specific types of electrical equipment called ground fault interrupters or GFIs, right? And those types of things are meant to essentially shut down the power supply to a unit if the circuit is overloaded, and it's meant to essentially ensure patient safety. Okay. So another thing that we touched on emergency action plans, but one thing that's also potentially not considered as much is having a crisis management plan. So we talked about active shooters, but also plans for dealing with mental health. You will oftentimes run into situations, and this happened to me when I was practicing. I'd get a phone call, hey, Wade, this is so and so over in X office on campus, and we have a student that's describing thoughts of suicide, that they are wanting to harm themselves. Or I have a student in my office that is very depressed and is just saying that they that there's tendencies for possible self-harm. Right, so we need to have a crisis management plan involved there and ready to be able to assist people that need it, right, with appropriate referral and who to contact and when. So obviously, one of the things we have to do when setting up a program is we have to make sure that we're, not only compliant with our institutional laws, right, and human resources laws that are kind of prevalent at the national and state level, but we also need to make sure that we're also in compliance with institutional guidelines in regards to human resources, as well as athletic training standards, right? We need to make sure that we are appropriately staffing our workplaces, right, to ensure appropriate safety of student athletes. For a long time as an athletic trainer, I was the sole athletic trainer with a football roster of 165 to 180 players, and I was also, the chief administrator as well, and that was a lot. It was a lot of work, but then also that begs the question: how safe is it to only have one medical professional with that amount of people, right? That could potentially create some problems, right? It's important also to delineate as well within your staff job descriptions, right? What's the role of the director of athletic training services? What do they do? Do they have a clinical assignment? Do they practice clinically, or are they just an administrator? What about your staff athletic trainers? What responsibilities do they have? Is it just patient care, or are they focused on other things as well? Who supervises the athletic trainer? And this is a big point of contention. And that this is changing for the better. Athletic trainers are supervised medically by physicians. So we report directly to physicians, and the care that we provide, even in the state of Minnesota, is is actually directly supervised by a physician. This is my protocol form for the state of Minnesota, right? And you can see, sorry for the kind of holding it up to the camera there, but you can see that our team physician here at Gustavus has actually directly signed off on my protocol sheet for the state of Minnesota that states what I can and cannot do and what skills I can and cannot use as an athletic trainer, right? You know, and obviously evaluation, we need to be able to evaluate the performance of our staff as well, right? So here's the thing, right? We need to also think about facilities, right? We need to be able to design a facility that meets the needs that we have individually, but also we should be be taking into account things like size, location, right? It should be easily accessible. It should be well lit, right? So that we can actually see patients, so that we can see what we're doing, be able to see well when we're treating patients, and and have appropriate areas for like exam rooms, things like that, appropriate storage. So this is actually a link, which is no longer working. Let's see. So this is actually some of the pictures of the athletic training facility at the University of Alabama. So pretty cool, right? You can kind of thumb through and kind of see this here, right? So you can see how this has been actually, very well thought out. Things have been designed very specifically. At the university that I was at, we had 4 different athletic training clinics on campus. Later trimmed it down to 3 and turned one of the old ones into storage as well. So, and you can see that design is very, very intentional. We have a separate hydrotherapy area here, and so, obviously very different based on different needs. Okay. So, all right. So obviously, we need to be able to delineate all these different spaces like we just kind of looked at there in the pictures. Treatment areas, electrotherapy, okay, rehab, taping, having a private exam room, okay, keeping our records, not only making sure that we have a space to hold records, but also that those records are secure, right? No one should just be able to walk in and access a patient record whenever they want. Often now what we're moving to, this is the case, this was the case when I left the college university practice setting to move into orthopedics. All of our records were electronic, right? All of our medical records were actually housed electronically, and the amount of paper that we kept was very minimal, right? Obviously, dedicated storage spaces and office spaces are important. It's important that when we have an athletic training facility, that it's well organized, right? Organization is key to preventing clutter, and also just kind of making sure that the space stays functional, because oftentimes you'll find that you have very limited space to work with. So organization is extremely important in helping you keep your sanity, right? So here's essentially a figure of an athletic training room in a lot of programs, and I think this might be the case in ours. Eventually, you'll have to actually design a facility potentially as a part of a project for a course. So this is actually, an example of a facility design. And you can see here the different areas that have been kind of delineated here in the plan, and everything is defined as to what goes where, right? So obviously, making sure that, if you're working, outside of the college university setting, ensuring that you define the scope of practice, not only for yourself, but for every provider that will be there and often that will be working there. And that's often done through state practice acts, right? And so you guys just saw a little bit of a copy of my protocol form for the state of Minnesota. So obviously, one of the things that's important is setting hours. When will your facility run? What will the jobs be and the roles be for the healthcare providers there, right? Making sure that obviously you've got appropriate ergonomics, not workonomics, sorry, work conditions, and kind of standards for work hardening if you're seeing patients in the industrial setting, job site analysis, all those types of things, right? And you may have different responsibilities even, like outreach and even potentially developing group fitness programs and or drug testing responsibilities in the event that you are in a corporate or industrial setting. Okay, record keeping, like we just talked about. Records within the athletic training room typically fall into many different kind of forms, right? So we have general medical records, documenting patient problems, examine it, essentially SOAP notes and clinical exam notes that document clinical exam for injuries, rehabilitation notes, if we're seeing a patient on the daily for rehab and treatment, right? Pardon me. Oftentimes too, we'll have reports that go out to coaches that detail practice limitations, injury reports that tell, who is injured, who is not, and what they can and cannot do in practice. And then often, we may have, demographic forms like then this here they call it a personal information card, but demographic forms that are sent along potentially with a student athlete for a doctor's appointment, and that's for insurance purposes and billing purposes. Okay. So confidentiality, like we just talked about, right? Very important that as we are essentially sharing, and in the event that we potentially are sharing medical records, that we are compliant with HIPAA as well. So we cannot release medical records to anyone, even a parent, actually. In the setting of in the collegiate setting, we can't release those records to a patient without the express permission of the patient, and oftentimes we'll have to get that release in writing. And then once we do, we're able to release those records, right? There will be times, and I've had this happen, where you will have maybe a parent that will submit documentation called medical power of attorney. Oftentimes what medical power of attorney does is it essentially defines the decision-making role, or gives the parent and or a specific guardian the right to make medical decisions for a patient when they are not able to do so. So you may see those occasionally. I've had a couple of those in my career that I've seen. So ultimately, though, with a lot of this documentation, we need to make sure that we're HIPAA compliant. Okay, private health information and or protected health information is anything that could personally identify who the patient is, right? Information about the path, about what happened, right? The injury, the illness, anything that could essentially identify who they are, right? A patient, however, can have access to the information whenever they want. But if that information is obviously shared in violation of HIPAA to someone to which it has not been released, there can be consequences for that, potentially fines and or criminal prosecution. If we have a release, that sign, we need to have that sign ideally at the beginning of the year. Okay, FERPA. So the Family Educational Rights and Privacy Act. Okay, this protects the rights of student educational records in the collegiate setting. Injury, clinical exam notes and SOAP notes may also fall under the purview of FERPA. That could be the case. If the patient is under 18, parents can have certain rights to those records, but once the patient hits 18, parents do not have free access to medical records for that child or for that adult, pardon me, unless there is written consent. All right, and one thing that's really important to note as well, a medical record is a living document, right? Imagine that this is something that a patient carries with them throughout their life. And I've had this happen to me. I've had this happen, when I worked at TRIA, because patients could see their medical records, right? And they could request corrections to be made to those records, actually. And I had a patient that, noticed a discrepancy once, from a provider that she saw and requested it was corrected. And so we made a notation to correct that, right? Okay, physicals, right? And or pre-participation exams, PPEs. Okay, really, these are extremely important because they can help identify individuals that have relevant family histories and or may be at risk by participation in athletics and or sports, right? So these will be, generally very comprehensive. They will look at many different areas, like, general sport injury history. Again, they'll go body region by body region, head, neck, spine, shoulder, hip, knee, ankle, foot, right? There'll even be specific questions in regards to cardiac history, general medical history, what medications are being taken. With our young ladies at the university that I used to work at, we had a specific form that was specifically designed for our women, our female athletes, and asked very specific questions in regards to women's health that were pertinent to them, right? So this is extremely important, particularly when it comes to protecting yourself against liability, because if you put someone out on the field with a known medical problem that has not been cleared, that can ultimately result in litigation against the athletic trainer and the supervising physician. So it's extremely important to make sure that you have this in place. Okay. Okay. So obviously, as we talked about, medical histories, right? Ultimately the way that we did it, that we chose to do it, is we would do a comprehensive pre-participation physical exam when the athlete came in the first year, and then every single year that medical history was updated, kind of keeping step with their medical history as it evolved, as they were continuing to participate in athletics. Their medical history changed, so we updated that every single year and made sure that we had documentation of that in their medical record, and that was updating vitals, and updating any changes to the clinical exam, blood pressure, height and weight, and then general injury history, right? So cardiovascular screening, this has been really kind of a topic of debate over the past few years within athletic training. There have been recommendations for blanket screening that have been made by certain organizations for all athletes. However, the only, and when I say that, we're talking about EKG and echoes, right? However, there are things that you can do with a stethoscope as an athletic trainer, like listening for abnormal heart sounds, right, and other pathology, and knowing when to refer. So, and the golden rule here is, when in doubt, send it out. If you're not sure about what's going on with someone, always refer, right? Because not only are you protecting the patient, you're protecting yourself, right? So, it's extremely important to consider, to get really good at knowing and working with people, right, as an athletic trainer. Really making sure that potentially, if you have even a patient that may display certain psychosocial characteristics that may put them at risk within a given sport, that you may need to keep that into consideration, or keep that in consideration, so that they don't essentially harm others, right? It's extremely important also to identify potentially any developmental delays or milestones or lack of developmental milestones that you might be able to identify in people, that may potentially predispose them to injury due to differences in body mass, and the development of sex characteristics, those types of things, to be able to really provide appropriate care. Okay. So more on pre-participation exams. We're generally doing an orthopedic screening, talking about wellness. A really big important one is also sickle cell trait screening. That is required. Every single student athlete at the Division III level, is required to show proof of sickle cell trait, and/or they used to be able to provide an exemption. I don't know if they still can, but they need to show proof of a positive test and/or have documentation of a test done at birth. All right. So obviously, with this exam, we know that there are situations that may arise which, based on the findings of an exam, an athlete may be disqualified from participation in a certain sport due to the inherent risk. For example, it is entirely possible that a student athlete that has a significant concussion history with some continued symptoms and/or protracted symptoms may not be able to play a contact sport or a collision sport, right? This has happened on more than one occasion, and you guys will see this in your careers as athletic trainers, right? You will have to essentially, get with your supervising physician to make that determination as to whether someone may or may not be able to participate. And those conversations can be very difficult. So, obviously, record keeping, we need to make sure that we're documenting appropriately, making sure that we're keeping appropriate demographics, right? here's the deal, documentation, particularly injury reports, documenting your evaluation of injuries, documenting your treatments, right? Those data should be locked up, to where they can't be freely accessed. But one thing to note, guys, and it can be difficult when you're practicing, but one thing that you have to do, you have to document your care. You have to document your injury evaluations. You have to document your treatments on your patients, right? Because here's the deal. If you, for example, get called into a court of law, if you have no proof, if you have no written documentation or proof that you performed a treatment or that you performed an evaluation, it didn't happen. In the eyes of the law, if it's not documented, it never happened, right? So having that documentation is vital, not only for the patient, because that's the patient's right, is to have documentation of their care, right? Because your care as an athletic trainer is a part of their medical history. I mean, it's also a part of their record, right? So obviously a little bit more here, making sure that we're documenting consistently. There are different formats for documentation. There are SOAP notes, right, which stands for objective assessment and plan. Maybe you're keeping records of administrative things like inventory of supplies, right? And then obviously annual and seasonal reports. Maybe it's budget. Maybe it is assessing what you'll need to order for the next year, right? What needs to be improved? Are there facility issues? Those types of things. Okay. So obviously, as we talked about, now a lot of documentation, particularly patient documentation, is happening now more electronically than ever, right? So it's important to select documentation programs or electronic systems. Here clinically, we use ATS, and I've used that previously as well. But we need to make sure that those are HIPAA compliant, that they're protected, right? And oftentimes, we use devices, laptops, iPads, any different type of device that can be used for documentation, right? So there are also different, like for example, with ATS, the NCAA actually can pull data from ATS, from the athletic trainer system, to be able to actually assess epidemiology. And this is so cool, it's stupid cool, right? They can actually pull data from our databases to assess the incidence and prevalence of injuries within collegiate athletics. And it's amazing that they can do that, right? So those two programs, if we've given permission for that, can talk to each other, right? And so obviously we use that epidemiological data to determine, to develop a scientific base for talking about injuries, right? How often do they happen? How do they happen, right? And that can actually help us establish a foundation for researching these injuries, right? And so it's extremely important, right, to utilize a program that's HIPAA compliant that is also linked with an injury surveillance system of some sort, right? So the National Safety Council is another one, right? They conduct an annual survey of football injury research, and this, covers, the public schools, colleges, like recreational / Pop Warner, and then professional as well. So the NCAA Daedalus system, which that's a new name that, so it's that's also something that is tracking injury rates. And that's done throughout the NCAA. All right, there are some others that are actually not listed here. So this is the high school. What's being referred to is actually the high school Rio program. That's actually headed up by some athletic trainers that are documenting the rates of injury within secondary schools. And so that is collects data on athlete exposures. So an athlete exposure is essentially one athlete participating in one practice or one game, right? And then tracking those injuries accordingly. Okay. So how is this data used? So if within the epidemiological data we notice a trend as to how certain injuries are happening, right, that may allow, like the NCAA and or the IUL or some other governing body, to make a decision, about maybe changing rules, about, maybe making further efforts at education for coaches, parents, athletes, making recommendations for manufacturers, right, or any other thing, right? Providing education to other stakeholders in the community as well, right? So, yeah, that data is extremely important. And as we, get further into the program, hopefully, God willing, we'll talk about those types of things because it's just super incredible. It's fascinating, and those are things that I think also serve as a potential next step in your athletic training career. Potentially, maybe you're interested in research. That could be something that you want to do. So, anyway, that's it for today. I hope you guys have a great fall break. Get some rest, spend time with your families, whatever you want to do. And I will see you guys next week for emergency skills. Okay. Have a great weekend, guys. Take care.